Buenas tardes a todos. Good afternoon, everybody. Just waiting a couple of more minutes and we are going to start soon.
Hello, everybody.
Buenas tardes.
Okay, ya estamos.
Okay, perfecto. So thank you so much for coming, Kate. And thank you everybody for coming as well. Today we have One World Surgery, and we are very excited because we are gonna learn a little bit about One World Surgery, all the initiatives that they are doing in Honduras and how they are replicating that in the Dominican Republic, and how they are changing their approach, like mission-based approach, to a more balanced approach that includes not only that mission driven, but also more local efforts and educational initiatives. So Kate, thank you so much for accepting our invitation, and please go ahead.
Okay, bueno, ya vamos a empezar. Let's get started. Emocionados y aquí estamos para compartir información sobre One World Surgery. Here to share a little bit more about our organization, One World Surgery. I have this presentation here and I will show you the agenda so we can see what we're going to cover. Aquí vamos a presentar la agenda. Si puedo hacer que cambie la lámina porque no me quiere cambiar. Entonces, espérame. Voy a salir de eso porque como que no quiere. A ver, voy a convertir pantalla otra vez para ver si me hace caso.
Okay.
Ahí. Okay. So this is our agenda for today. We're going to start with some quick introductions, talk about our history and mission as an organization, our current programs and our impact, and then a little bit about a patient story. And then hopefully we have time for a small discussion. Entonces empezamos con introducciones, presentarnos a ustedes igual la historia y misión de nuestra ONG, presentar lo que son los programas y el impacto que tenemos actualmente, y una historia de un paciente que el doctor va a compartir con ustedes y una pequeña discusión si haya tiempo. So quick introduction. So I'm Kate, and this photo is from 2011. I've been involved with the organization for a long time, and I included a very old photo. I also included an old photo of Dr. Marilyn, although he looks the exact same. So, aunque eso es hace 6 años, el Dr. Marilyn se ve igual, pero esta foto de mí son hace como 11 años cuando empecé con la ONG. So I started as a volunteer with this organization. I did a year of service in Honduras, and then I worked at some other organizations and came back, and now have the pleasure of serving as our Director of Programs and Operations. Yo empecé en el 11 como voluntaria, entonces trabajé con otros ONGs por un rato, y después volví a trabajar con One World Surgery hace 5 años, y ahora soy directora de programas y operaciones, ¿verdad? And then Marilyn, como dije,
Oh.
Creo que hemos perdido el
Yeah.
audio.
Kate, oh, you are here.
Did we lose Kate?
no aguanta el internet, ¿verdad?
Yeah, Kate is here again, yes.
Hi, friends. Creo que el internet no aguanta. I think my internet is not good enough. Can you hear me now?
Yes, we can hear you.
Okay, so Dr. Marilyn's been with us. Marilyn, remind me, how many years now? I know he's in mute.
Uh, 9 years. Sorry.
9 years.
Yeah. So we have a lot of time with the organization and happy to share some details about what we do. So we'll keep moving. I really am worried about our internet, my friends. We're still here?
Yes.
Okay. Entonces, nuestra historia empieza con esa bonita pareja aquí, que es el Dr. Daly y su esposa Lulu, quien es enfermera. Entonces, ellos empezaron con nosotros, bueno, hace varios años, en los 2005 por ahí, cuando visitaron a nuestros socios locales que se llaman Nuestros Pequeños Hermanos. Empezaron trabajando con ellos en proyectitos pequeños, pero lo que pasó después de un rato de trabajar, el Dr. Daly, como es ortopeda, realmente se dio cuenta que podría dar más. Entonces presentaron al caso de Ángela, que es esa niña bien bonita, a él, y dijo, wow, yo quiero hacer más, pero realmente en aquel momento solo tenían este trailer como quirófano, y decían, y no puede hacer digamos, la cirugía en este trailer, y claro que no, que es una cirugía bien complejo, y después se fijó que realmente hay muchos pacientes que necesitan ese tipo de ayuda, como bien todos en esa llamada saben, que hay muchos que necesitan ese tipo de ayuda. Entonces, Angela fue con ellos a los Estados Unidos para su procedimiento, pero ellos cuando volvieran a, digamos, hacer que Angela estaba otra vez en su casa, ella decía a ellos, por favor, quédense conmigo y de repente ayuden a mis hermanos y hermanas y en otros del país. Y esto fue un momento clave en la ONG porque pues en aquel momento Lulu dijo al Dr. Daly, tenemos que quedar y tenemos que hacer algo. Entonces, de ahí empezó todo lo que es One World Surgery. So, really starting with our founders and getting involved with our local partners called Nuestros Pequeños Hermanos. It's a home for children. Dr. Daly, as an orthopedic surgeon, wanted to do more than visit and do some small health projects, especially when they met this beautiful young woman, Angela, and were asked to do her procedure in this trailer. So, of course, that was not going to be possible. And so we said, okay, what can we do? Dr. Daly and his wife brought Angela to the United States. They did her procedure. And when they brought her back, she turned and said, please stay with me. She didn't say, take me back to Minnesota and let's go back home to your home in the United States. She said, stay with me. So Lulu looked at Dr. Daly and said, we have to do something. So that's where this all started. I would love, Viviana, I have no idea if this is going to work, pero vamos a intentarlo. This video is really great. I think that it gives a great overview. So vamos a ver si este video me quiere compartir. Vamos a ver, porque eso es el video. Le voy a dar un clic. Ok. Escuchen el sonido.
Honduras es un país empobrecido. Personas no tienen recursos y dependen de sus manos. Yo trabajo en el campo, con la tierra, con ganado. Tengo que generar ingresos para mantenerme a mí y mi familia. Con mi brazo derecho imposibilitado no podría trabajar. Es una bendición pues que el centro esté atendiéndonos.
The whole mission of One World Surgery was really born out of the lack of adequate surgical care that 5 billion people across the globe experience. Surgically treatable conditions now result in more deaths than HIV, malaria, and tuberculosis combined. And that's our goal, is to really address that discrepancy. It really requires partnering with the local community, to be rooted in the community and to incorporate them in our efforts and do it as a team.
The mission of One World Surgery is to give access to surgical care and to ignite the spirit of service. One World Surgery's 3 cornerstone programs include operating global surgery centers, leading surgical medical missions, and supporting local medical communities through education and training.
Our surgery center is located within the property of Nuestros Pequeños Hermanos, which is a 2,000-acre property, which is home for abandoned and orphaned children. This is the place where I actually grew up, and I decided to be a doctor since I was in first grade. I am the full-time on-site medical director. I met Dr. Daly, and he's such a kind person that actually, inspired me to become an orthopedic surgeon. Well, the surgery center has grown a lot. We have currently 3 operating rooms. We have 7 beds that can be used for overnight patients. We have a dental clinic and an eye clinic. For the majority of our patients, we provide care that will be otherwise impossible.
Medical mission trip is when physicians, clinicians, non-clinical volunteers and their families come down to Honduras for a week to perform life-changing surgeries. usually 2 times per month, and up to 60 volunteers each brigade.
One World Surgery gives the opportunity to come down, to bring your entire family, and to experience something that you would never be able to experience at home. You can't teach this in a classroom. All the people around you, everything's contagious. Everyone's excited, everyone wants to serve.
It really doesn't matter what skills you have or where you're from, everybody becomes a big family.
One of the most important pillars is education. Education exchanges ideas with the local medical community and builds the fabric of healthcare in that community we're serving.
One World Surgery me ha dado entrenamiento y capacitación con cuidado del paciente, administrativo, para mejorar mis habilidades como enfermera y como líder del staff.
A key enabler or tool for our level of education is our conference center. We have a large facility that can host 300 participants, the exchange of ideas, presentations. We're not just coming in and out, we're really part of their lives there and elevating the level of training for all involved, for ourselves and for them.
When we first started all of this, we really didn't have a dream. We were just saying yes to the needs in front of us.
As One World Surgery has grown, we've been able to perfect some of these operational processes and develop a model that we can take to other sites. It only makes me more excited for the potential that we have to grow and replicate this. Billions continue to lack access to safe surgical care. Even though a surgical procedure is only $250, that amount is out of reach for patients in developing countries.
It is amazing to see how surgery can transform the life of our patients. After getting surgery with us, they can go back and support their family and having a bright future.
Somos una población bastante necesitada. Toda persona necesita su cuerpo para poder trabajar. Me siento agradecido con todo el personal de aquí del centro.
Coming down to Honduras is a great experience. It just really inspires people to take a deep breath, give thanks for what you have.
Amo bastante mi trabajo, más que todo porque estoy como al servicio de los que más lo necesitan.
Vine aquí buscando mi opción y creo que si no hubiera encontrado yo este lugar y esta gente tan capacitada, no hubiera podido nunca superar mi problema. Creo que no he recibido más satisfacción más grande en mi vida que poder volver a recuperar. Creo que no encontraría las palabras adecuadas para decir la emoción que tengo de volver a ser yo misma.
My hope is really that you would join us in fulfilling this medical mission and igniting the spirit of service in yourself and in those around you, and help fulfill this unmet need.
Entonces, como el video está en inglés, lo voy a explicar un poquito en español, igual los 3 programas que manejamos, pero primero, eso es nuestra mission. So the video is in English and of course gives an overview of our 3 programs, but I want to first share our mission, this organization that was created by Dr. Daly and his wife out of love for Angela, one of our first patients, and then of course all the patients that we serve. We're really trying to transform lives by providing that access to surgical care. But also it's really transforming the lives of the people who are involved in the organization, both our staff, our volunteers, our patients. It's not just about the patient getting, their surgery taken care of, but it's also about getting people excited about this mission to serve and to help others and to have their lives transformed by it. Entonces nuestra misión tiene 2 componentes que realmente no solamente es transformar la vida del paciente y ofrecerles algo que de repente no tienen acceso antes, pero igual transformar las vidas de todos que están involucrados, los voluntarios, los que trabajan con nosotros, pues todos, y realmente hacer que todo el mundo está feliz de poder servir a los demás. So here are the 3 programs that we run, and I'll explain how we've actually expanded since this video. We have some more programs, but these are really the heart and soul of it. And I think what I would really highlight is that the surgery center and our Honduran team and having that local team really help with the pre and post-op and even doing care during COVID when we actually couldn't have medical missions. That is so important. And it's become such an important part of our organization. We started as a mission organization. We started primarily doing brigades, and actually only doing brigades to Honduras, and now we've really expanded. We employ over 40 Honduran staff members at the center, and honestly, with our part-time employees, it gets up to near 70. And every single day, we're providing care, not having to wait for the missions to come down. Of course, when they do, we're able to do different specialties, different procedures, but having that local team is just critically important. And I'll talk a little bit more about education in a second. Entonces, realmente nosotros empezamos como una ONG solamente con brigadas, con missions. Y eso fue como empezamos al inicio, pero nos damos cuenta que realmente para tener más sostenibilidad y poder ofrecer los servicios que nuestros pacientes merecen, era necesario y 100% obligatorio tener un equipo local. Entonces, nuestro liderazgo local, nuestro equipo son casi como 40 personas permanentes y hace 70 que ayudan con varios servicios. Ofrecen el cuidado y atención en todo el año. Entonces, de repente tenemos a COVID, otra cosa que no, bueno, no permite que vienen las brigadas, pero igual nosotros sigamos trabajando y ofreciendo los servicios a nuestros pacientes. Igual las brigadas son importantes también porque cuando vienen podemos atender a más pacientes y tal vez otras especialidades que no hemos podido atender en el pasado, pero igual eso ya queda como la fundación de toda la ONG. Education has become so important to us. This is a slide just kind of giving a couple of our programs within education. It's something that's very new. We realized that, you know, the brigades were a good start. The local team is another fantastic way to offer our services. But if we're not extending ourselves beyond our four walls, maybe we're not doing as much as we can. And so we've really started to invest very heavily in education. We've started a fellowship program, a surgical fellowship program. The training in Honduras is very good. Of course, we have some fantastic surgeons in Honduras, but there are added skills and skill sets and special, you know, subspecialties within that training that they don't get as much exposure to. So our goal is that within these two specialties to start, ophthalmology and orthopedics, we can offer a year of extended training within those two specialties. This is our ophthalmology fellow here from last year, Dr. Ponce, surrounded by our local team and a U.S. surgeon who came down to exchange with him. These are our two current orthopedic fellows. We have our first group right now. We also have educational workshops and seminars that we do with the surgical support staff. So anesthesia personnel, we're expanding that out into our nurses, scrub techs, circulators. Really the goal here is that, you know, obviously it's not just about the surgeon, but we need to make sure that everybody else that, you know, surrounds them and helps and supports has that training that they need. And then kind of the third area is our scholarships and exposure to careers in healthcare. So thinking about the future, you'll recognize Angela here from that first photo. She's now approaching 30 years old and she's finishing her scrub tech training with us and actually works here at the center most of the time. So these projects and programs are really great for future sustainability and also just, like I said, to extend ourselves beyond our four walls and go beyond being a mission organization to really trying to do more work in the communities. Entonces, cuando tiene que ver con la parte educativa, nosotros nos damos cuenta que realmente si estamos solamente dentro de nuestras paredes, no podemos de repente tener un impacto que realmente queremos en las comunidades. Entonces, empezamos realmente en los últimos años, 2 años, este programa del fellowship, que ya es para cirujanos graduados, que han recibido una buena educación, o sea, son muy buenos cirujanos, pero igual tal vez no han tenido un entrenamiento extra con algunos de los técnicos y otras cosas dentro de sus especialidades. Entonces empezamos con ortopedia, que eso es nuestro fuerte, lo que hacemos más que todo, pero igual tenemos otro fellowship en oftalmología. Entonces es el primer fellow de oftalmología acá, el doctor Ponce, que graduó en enero de nuestro programa, y con nuestro equipo local y el doctor Barber de los Estados Unidos, que está apoyando siempre en la parte educativa. Y esos son los 2 fellows de ortopedia que están aquí con nosotros en este año. Igual hacemos entrenamientos y otros talleres con las personas que apoyan al cirujano, porque sabemos que no solamente es el cirujano. Entonces, estamos trabajando más que todo con los técnicos de anestesia, pero igual pensamos expandir ese programa para también ofrecer ayudas y talleres y entrenamientos a las enfermeras y instrumentistas. Y aquí tenemos a Angela, porque tenemos otro programa que ya son becas para personas que quieren estudiar carreras en salud. Entonces ella ya tiene sus 30 años, ha madurado desde esas primeras fotos cuando tenía sus 8 años y ahora está más bien trabajando con nosotros y recibiendo una beca para trabajar, ¿verdad? Entonces bonito que todo un ciclo con ella del inicio de su procedimiento como paciente y ahora una de las becadas. Another thing that we have started and expanded, as Bibiana mentioned, is that we are expanding into the Dominican Republic. So we've had a very successful model. I'll share some of the impact and outcomes with you in just a second. But we want to replicate what we're doing in Honduras in the Dominican. In the Dominican Republic, it's a beautiful country, very wonderful things about their healthcare system, but we see very similar to Honduras, a lack of access for people who either don't have insurance or don't have the resources, in particular Haitian immigrants who now reside in the Dominican Republic. So we're in the process of replicating. And what we did in the Dominican while we're building the surgery centers, we did this needs assessment and we started to work out in the communities. And we started to think about, okay, are there primary care efforts that, of course, will help with surgical optimization and prepare patients for surgery. But again, maybe there's patients who actually don't need surgery, and we can look at this a little bit more holistically and offer them support in the primary care space. So really wonderful work that's been done in the Dominican Republic, even before the surgery center started. And Honduras has actually adapted a lot of what they're doing in the DR to offer primary care services to our patients here in Honduras. So really just starting to look at the patient more holistically. Patients are really falling through the crack. Entonces aquí tenemos no es una pota real, pero eso es lo que va a haber en la República Dominicana, que está ya terminando, que nosotros hemos tenido tanto éxito en Honduras que tenemos esas ganas de expandirnos y estar sirviendo a la comunidad allá. Claro que ellos tienen un sistema de salud bueno y tienen éxito dentro de ese sistema, pero como hemos, y todos ustedes han visto en casi todos los países, realmente siempre quedan algunas personas que no tienen acceso. Entonces, más que todo en Dominicana, son los pacientes que vienen de Haití, que ahora viven allá en la República Dominicana, que no tienen acceso a esos servicios quirúrgicos, ¿verdad? Entonces, allá para empezar bien con el programa, empezaron en las comunidades con una atención primaria. ¿Quién necesita cirugía? O si no necesitan cirugía, podemos ofrecer otro servicio para alistarles o para su cirugía o no. Igual ofrecerles algo más holístico, porque realmente la cirugía es una parte, pero queremos poder ofrecer todas las partes y todo el cuidado que necesita el paciente. Y ahora mismo lo de primary care de la República Dominicana ya lo estamos haciendo en Honduras igual. Entonces en ambos países la meta es ofrecer servicios holísticos a esos pacientes que realmente no tienen acceso, ¿verdad? So here's some of our impacts. So last year was our biggest year yet, which we're very excited about. You can obviously read what's on the screen here, but I guess I'll just share that we keep growing. So this 21,000 number represents patients who have received surgery and consults across both countries. The number the year prior was right around 10,000. So there's a lot of growth, a lot of expansion. I'll also mention we are very, very proud of our infection rate, less than 1%, our readmission rate, less than 1%, and our post-op complication rate, also less than 1%. So very, very proud to get some fantastic surgical outcomes. And this is really due to having that local team that's partnering with those missions that come down, and now the education piece. So we think it's really important to have all those components because otherwise we're not so sure that we would actually get some of these results that we're getting. So again, our volumes are growing and increasing. We're using our surgery centers more and more. We're serving more patients. We also fortunately had the most medical missions we had ever had. So we had a lot of groups coming down, but they were much smaller because of COVID. So not quite the most volunteers, but still a lot of groups coming down. Entonces, eso es una lámina que explica sobre el impacto, ¿verdad? Según los números, y lo que puedo mencionar es que nosotros sigamos creciendo. El 2020 eran como 10,000 pacientes. Aquí representa el número de pacientes quirúrgicos, igual que han recibido consultas. Entonces ya hemos sobrepasado 20,000 y estamos súper orgullosos de eso, porque realmente es un logro y sentimos como que seguimos creciendo, pero también vamos a siempre mantener la calidad. Entonces ahí menciono eso de disminuir la cantidad de infecciones, problemas postquirúrgicos. Entonces, todo eso está bajo 1%. Entonces, eso es algo que siempre muy importante para nosotros. Igual, aumentamos el número de brigadas, pero no habían tantos voluntarios en el 2021 por lo de COVID, pero ahí vamos recuperando nuestros números. Entonces, again, just we are a very data-driven organization, and that's another thing that's really important. We track all of these numbers and all of this data. There's many more to share. We've published articles just to show the impact and show that the model is working, and we'll be happy to share some of those after the presentation. La verdad, para nosotros tener datos y tener estadísticas es bastante importante. Realmente hay más que lo que tengo aquí en la pantalla. Igual hemos publicado algunos artículos sobre el modelo y cómo funciona, y con gusto los comparto después de la presentación. So I'm going to stop talking and pass the word to Marilyn. And I think what I would say before Dr. Marilyn starts speaking is that really, you see the numbers, you see the model, but it's really about that patient and their family and their community. And so it's much more than, 20,000, but what did it really mean to all of those patients? So Marilyn's going to share a patient story. I'll also mention that we used to say that we just, we provided care that was otherwise impossible, and we provided hope. But now we say we're empowering the leaders in healthcare. So this is really, the education piece of this is so important. And Dr. Marilyn, as our leader in Honduras, and also leading this fellowship program and training program, it's just so important that we're able to train and retrain and expand this. Entonces, el impacto es mucho más allá que los números. Cada paciente tiene una historia. Entonces, Dr. Marilyn va a contar una historia de un paciente. Igual mencionar que al inicio era solamente, o sea, no solamente, pero saber que realmente estamos haciendo un cambio que hace algo imposible, lo hace posible para un paciente, y damos esperanza al paciente, pero ahora estamos empoderando líderes de salud en esos países. Entonces, Marilyn es un ejemplo de esos líderes, pero igual él es líder de empoderar a otros líderes hondureños. Entonces, está manejando y liderando el fellowship. Entonces, ahí Doc, le doy la palabra y solo me dice cuando cambie la lámina.
So the story of this young lady, she lives like 5 hours away from our local place. We're in the capital, and she lives like in industrial capital of Honduras. For the record, we have patients coming from every corner of Honduras, and we have 10.5 million people. So the thing with her is that she was in a lot of pain for several months. She was not able to sleep well because of the pain in her right shoulder. This is a picture of the day that I saw her for the first time over here. And so the thing is that she was knocking the doors in the different public hospitals, and she was not able to find an answer to saving the arm. It was just like disarticulating the arm, meaning like taking the whole arm because of the tumor. And so there was not a defined diagnosis. So some said it was malignant, some said that it was benign. And so she, posted her story on Facebook, and someone said like, try to reach out to these guys. If these guys cannot do something for you in Honduras, then you have no options. She had, you can go to the next slide. Okay. She had, asked in private places in Honduras, and she also had applied, to some hospitals in Costa Rica. And, like just here in Central America, it will cost her to save her arm like $30,000. And to go there, she has a baby, son, and her husband, and like $30,000 is a lot. I mean, for many of our places in Honduras, you can buy a house for that amount of money. And so this is an image of the one that she brought, and on the left of the screen, you can see the X-ray where she had a tumor that is kind of causing osteolysis of the whole humeral head. And then on the right, you can see the MRI, it's like within a ball, but, like it's so aggressive, even if it is benign or in this case, like it is destructive. So that makes it aggressive and kind of like a malignant behavior. You can go to the next slide, Kate. This is the x-ray we took with the C-arm at our place. At that time, our x-ray machine was broken and we couldn't do much more than that, but you can see that there is no bone whatsoever in the periphery of what had to be the head. And so the thing is, okay, we have a biopsy. The biopsy says that is benign tumor, but the tumor is so aggressive. We know that we need to stage it. Is that something that we can do in our surgery center or not? And what are the steps to save the limb on this patient? And then you can go ahead, Kate. So talking with some of the surgeons that come to our place, because we have in constant communication with surgeons that come from different places in the States. We said, we can do a few stages if we need to. And the first thing that we did was to do a in-block resection of the tumor, remove everything that was dead or within the tumor and the whole capsule, and trying to preserve everything that was healthy. For the patient's benefit, we could find really clean margins everywhere, and the whole tumor was contained into like a pseudo capsule. And a lot of surgery is being creative, especially not having enough resources in a place. We had this implant that is supposed to be in a hip, but we decided to use it for the humerus just to preserve the space and preserve the length and a little bit of comfort to the patient. Go to the next slide, Kate. And so we took some follow-up pictures and x-rays. We just wanted to make sure that the patient didn't have like a recurrence of the tumor. And we know by this time that it was negative for malignancy, but still you need to make sure clinically. So this is a few months after that. Next one, Kate. So this is a video of her with that implant that is supposed to be a hip. The tumor is fine. The best thing that you can play as I talk, Kate.
Buenos días, doctor. Este video es para mostrar.
Yeah, so the best thing is that, she doesn't move around, like she cannot lift it, she cannot go around, but she can sleep really well. She slept like a baby, like day after surgery, no pain. And then there was no, recurrence of the tumor, and then the skin looks fine, and she can still, work with the distal part of the limb. And she's happy with that. Okay, so we're planning on what is the next step, what are we going to do, because she lives so far away. We had to just like go through video and WhatsApp and phone calls. Next slide. So the next thing that we had to do is like replace that hip implant that was put in a humerus, and find a prosthetic. Like that prosthetic here in Honduras, because it is customized, can cost around $7,000, $10,000. And just because we can knock on so many doors at the same time, we got this as a donation for the patient. And we did surgery. We got the perfect length. We decided to put a reverse to the shoulder, which is more for older patients, about 60, but since she had a deficiency of the rotator cuff, because some of them we took away, we decided to do this one. And this is the way that it looks and on this patient. And go next, Kate. So, and we took some others later, and there's still no recurrence of the tumor. And so we're so happy for that. And then, hoping that she might have a limb that will, will give her the opportunity to work in a society that is so competitive, and where she is striving to go to university, and where she is trying to have a job to, be part of a family, a functional family. Next slide, please. And so this is her, like almost a year post-op. And you can see, she's just sending a video saying like, this is all that I can do now after the last surgery. And so I think that the only thing that she doesn't like is the scar, even though we did close her beautifully. I wanted to be a plastic surgeon before being an orthopedic surgeon, but sometimes it's just your body. But you can see the motion. I mean, if you didn't see the scar, you wouldn't tell that she had a surgery. And she can go back and she's just saying like, oh, look what I do, and I can do all the way around. I mean, it's just amazing. As a surgeon, I love that. It's a wonderful result. And perhaps you're not going to be that lucky every time to get that amount of motion. But the one thing that actually motivates me to see all this type of stuff is just the fact that as Kate was telling you the story in the very beginning, it's just Angela traveling to the United States to get surgery. And then the doctor, Dr. Daly and Lulu saying, okay, we got to do something in Honduras where we can do leader procedures. You saw that we're doing close to 2,000 surgeries in Honduras. And we have similar stories every day like her, that they're just like trying really hard in the system that won't provide for them the implant, and it makes it impossible for them. And it's so easy to do an amputation. So, and to see how people are seeking help everywhere, and to see Honduran coming from every corner of Honduras because they heard of this good place locally, and to see like our center grow from like just a few missions when Kate was here in the year to have like 30 missions a year. We're doing fantastic there. And then running a surgery center that is successful locally with the highest standards, that's success. And the one pillar cornerstone that we were just not working on was education. And like right now, as Kate was mentioning to you, we have the first fellowship for ophthalmology in the country. We have the first fellowship for orthopedics in the country. Anybody else before had to leave the country, and we have some spots based on our resources. But if we don't get, like if you want to get a fellowship, otherwise you will have to leave the country for that. But this is the type of impact we're creating. We're having a wonderful team that is working really hard, and we have like a lot of stars that make our mission successful. And Janet is just one of those wonderful stories that, we touched her life in a way that she won't forget about us ever. I mean, she's back to university. She's, working hard with her husband to raise their son. I mean, you want one time in your life, one opportunity like that. Okay. You can take that, Kate.
Yeah, so thank you, Dr. Marilyn. Gracias, Doc. I know this part was just in English, so it sounds like people are hearing the story, but hopefully you saw some of those images in the Spanish on there and saw the image of the young woman. Entonces, solo enfatizando lo que dijo el doc en español igual para los que están hispanohablantes aquí en la llamada. Realmente él está feliz, yo lo escucho súper contenta el doc, tener un paciente como ella que una situación tan difícil que le habían dicho que no tienes otra opción, si este centro no le puede ayudar, entonces no va a tener opción. Entonces, qué bonito pues que pudimos hacer algo, bueno, y algo bonito para ella. Y enfatizando, el doc dijo que este fellowship que manejamos de oftalmología, igual de ortopedia, es el primero en el país. Y los médicos antes tenían que salir del país, ir a otro país para aprender y hacer su fellowship, pero ahora pueden quedar aquí en Honduras y realmente tener un impacto. Entonces, eso es el mensaje clave. I would love to hear any questions. I want to say we're growing, but we'd also like to learn. So any ideas on how we might serve our patients better? We would love to hear any ideas from the audience, something that you've experienced at your organization. We're happy to hear. Entonces, cualquier pregunta que quieren hacer, podemos contestar. Igual, nosotros estamos creciendo y todo, pero igual buscando ayuda. Entonces, si tienen ideas, experiencias propias de sus ONGs o donde ustedes están trabajando, que igual no compartirlas, pues, porque nosotros sí estamos aquí para aprender. So yeah, I will open. I do see a question in the chat. Cuidado, solo haitianos. Ajá. La pregunta es si vamos a atender a solamente los haitianos allá en Dominicana. No, nosotros vamos a atender al paciente que necesita ayuda. Y puede ser haitiano, dominicano, hondureño, no importa. Entonces ahí estamos para atender. Solo sabemos que esta comunidad no tiene mucho acceso a la salud porque los haitianos, de repente, si no tienen papeles, el sistema público no les va a atender. Y entonces por esa razón quedan sin opciones. So in the Dominican Republic, we will attend to Dominicans, we'll attend to Haitians and anybody who needs help. We're not specific to where you're from. We just know that the Haitian community in the Dominican is very underserved. A lot of them don't have papers as legal citizens in the DR, meaning that they cannot access the public system. So that's just why we know that they're going to need more help. Preguntas, tenemos 15 minutos.
Creo que había otra pregunta en el chat, que era ¿en qué ciudad está basada el nuevo centro en República Dominicana? What is the city in the Dominican Republic where the center is based?
Yeah, so the Dominican Republic Center is located just north of San Pedro de Macorís. So right between Punta Cana and Santo Domingo. Estamos ubicados allí fuerita de San Pedro de Macorís al norte y justo en el medio entre Punta Cana y Santo Domingo. And that's where a lot of the sugarcane workers are living. So a lot of the people who have either come from Haiti or were brought from Haiti, that's where a lot of them reside. So we are building our center in the middle of the sugarcane fields. Estamos construyendo el centro justo en el medio de las comunidades donde viven los trabajadores de las fincas de caña, ¿verdad?
I have a question, if I may ask, English.
Yes.
So a lot of the work is orthopedic, and that usually requires a selection of instrumentation, plates, screws, devices. Could you tell us a little bit of how you've been able to, what type of a supply of these kinds of orthopedic instrumentations you've been able to keep? Do you maintain a large supply? Do you have regular donations? Do you acquire them through a variety of sources?
Yeah, preguntando más que todo sobre los implantes y instrumentos de cirugía de ortopedia y cómo lo conseguimos y si mantenemos un supply, un stock. Yeah, so we've been very fortunate to have many instrument sets donated to us that we get replenished on a donation basis from our vendor partners, DePuy Synthes, Stryker, Zimmer, to name a few. But because of COVID, we realized that sometimes that's not consistent. A lot of the companies stopped donating. So what we actually did is we formed a partnership with a smaller company called Ortho Implant Company, and they are fantastic. They get us our implants at cost. So it's not free, but it's close. So the partnership with them, at least for trauma, has been extremely successful. And Dr. Marilyn can add to this. For our total joints, those are all donation based, and we continue to rely on Stryker, Zimmer. We apply on a regular basis, and they grant those donations. Entonces nosotros sí tenemos varios sets de instrumentos aquí presentes en el centro que han sido donados. Llenamos estos sets con implantes igual donados por esas empresas grandes de los Estados Unidos, entregando la aplicación y todo, y ellos, gracias a Dios, que han sido, o sea, siguen donando siempre. Con la pandemia sí buscamos otra solución igual, porque una de esas empresas decidieron ya no donar tanto. Entonces tenemos un socio, una alianza con una empresa pequeña que se llama Ortho Implant Company. Ellos sí nos dan los implantes a costo, o sea, no tienen ganancia ellos. Entonces este socio ha sido bien bonito para lo de traumatología, pero ya para los prótesis, eso es pura donación de parte de Stryker y Zimmer y aplicaciones. Doc, what would you add? ¿Podría agregar algo? Oh.
Yeah, so I would say that we have like a very modern, complex ambulatory surgery center, and we're trying to give the best care we can to the patients in Honduras. And our hospital can, you know, if it is quality wise, we can compete with the best hospital in the city. And so we have a lot of like the sets of instruments that we need for surgery for 8 different specialties that we have. And we have found like different ways to procure the implants, because the replenish is a big deal. And so, like Kate said, through vendors or through doctors and their reps, we get, you know, like total joints, or we get implants for sports, or with this small company too. But every once in a while we get, you know, someone saying, we got this amount of implants, can you use them? I mean, even if we're going to use it for a few patients, still makes a big impact, and we decide to do that. Sometimes when total joints, because it's a little more complex, we ask the surgeons and the team coming to bring some of those instruments, and they can take them back. But as much as we want, we're trying to have enough so that we can keep operations going when we have no missions too.
If I may, just one other question, and that has to do with, is it presumed that everybody who comes to your door is without any means, or is there any type of a means testing as to whether people can make a contribution to their surgery?
Buenísima pregunta, preguntando sobre cómo decidimos si un paciente va a recibir la cirugía o no, y saber si realmente tiene la necesidad. That was one of the very first things that Marilyn and I worked on when I joined the organization, and 6 years ago. We hired a social worker. Now we have 2 social workers, and absolutely they meet with our surgical patients to determine eligibility. We do understand that some of the surgeries we do are so complex that even if you have a fairly good paying job, you still can't get access to it. So we do take that into consideration. But yes, absolutely, patients do pass through social work and are prioritized according to socioeconomic need. Entonces, nuestro departamento de trabajo social tiene su reunión con todos los pacientes quirúrgicos antes de su cirugía para decidir qué nivel de necesidad tienen. Entonces, eso es muy importante para poder priorizar los pacientes. Igual entendemos que hay algunos que tal vez tienen un ingreso mediano, digamos de clase media, puede ser que tampoco tienen acceso a las cirugías con la complejidad que nosotros atendemos. Entonces, eso lo tomamos en cuenta igual. But yes, we have a extensive process. Yeah, go ahead, Nicole.
Hi, first of all, hello to everyone. Nicole Bornigal, Executive Director of Operation Smile, Dominican Republic. I'm very excited to see other projects happening here in the country. I had no idea of this beautiful center. I don't know if it's already done or if it's almost done. I had a couple of questions regarding of the care there, just to understand a little bit. are you using local volunteers here in Dominican Republic to have these surgeries based on what you explained in the beginning of the model in Honduras, that I saw that you have maybe international volunteers flying for a week and having a full list, or let's say day of surgeries, a week of surgeries, and also trainings? Are you implementing that same model here in Dominican Republic, or planning if the center is still not done, or is it 100% based in international doctors or a mix of local and international? So that's my question. I don't know if you want me to say everything I just said in Spanish.
Ella está preguntando si... Go ahead, Nicole.
Hola, Nicole Burnigal de República Dominicana, Operación Sonrisa, soy la directora ejecutiva y estaba preguntando primero felicitando por este centro que no tenía conocimiento en San Pedro de Macorís, y quería saber si es parecido o si ya están ejecutando el mismo modelo que en Honduras, basado en la colaboración de médicos internacionales para hacer estas jornadas de cirugías, o si están utilizando médicos locales dominicanos y entrenándolos. Básicamente la pregunta.
Yeah, so the short answer is that we have learned that the model in Honduras is so important. We must have a local leadership and team, and we're doing the same in the Dominican. So we just hired our medical director, orthopedic surgeon, Doctora Joyce Morillo. So she's from Santo Domingo. So she'll be our leader in the DR, and she's starting to form her team. So we're recruiting her nurses, her OR staff, we have a couple physicians who have already started. So absolutely, yes, we'll have a local team, as well as the medical missions coming down to support, but it's the same model. In the Dominican, we will probably have more Dominican surgeon volunteers to support Dr. Joyce than we do in Honduras. Honduras is really focused on that fellowship. The Dominican's going to start by having a couple representatives by specialty, local Dominican physicians to help. So it's a little bit different in that way, but similar. Entonces la respuesta es que sí, que vamos a hacer igual como Honduras, porque es súper importante tener las brigadas trabajando con un equipo local para poder tener los resultados que tenemos. Entonces ya tenemos la director médico, quien es Joyce Morillo de Santo Domingo, y ella está seleccionando su equipo y vamos a ir contratando. Entonces no hemos empezado, the center is not open. Okay. El centro abre el otro año, entonces ahora es momento de contratación. Si conoce a alguien, que me avisa, por favor, enfermeras, sí, instrumentistas, personas. Sí, en serio.
Todo va a ser enfocado primero en ortopedia. O sea, ese es el enfoque.
We in the Dominican are starting, so when we worked in the communities, we learned orthopedics, ophthalmology, general surgery, and ENT. Entonces esos cuatro vamos a empezar en Dominicana: ortopedia, cirugía general, otorrinolaringología y oftalmología.
Yeah, reach out to me and I can give you a couple of names, and maybe if they can't participate, they can recruit other specialties in that area, because I do know a lot of different doctors in those specialties. So
yeah,
great.
I just add that to have a successful operation mission like this, a lot of the surgeons are, asking like, who's going to take care of my patients? And so that's why it is important to have a local group taking care of those patients and even communicating with them biopsies, or what do we do if this goes, what do we do now that the fracture is healed? When can they come out of the cast? Or what do we do when, you need to have a local strong team to move that volume and have less complications. And you need to also have control of the facility to have more production, I would say, because when you're doing mission in a national hospital, then you depend on their time. You cannot control that, and you need to control all vectors. I think Dan Peterson had a question.
There are two more people and we have 5 minutes, so okay, we can go a little bit over, but I don't want to mess up with the time. Go ahead, Dan.
Just a quick question. This was wonderful, Kate and Dr. Merlin. My question is follow up to Dr. Moser's question about the preoperative part. How do you find the patients, or how do the patients find you? So how is that working? How's it working now in Honduras, and how's it going to be working in the DR?
So Marilyn might remember 10 years ago, we had to get on the radio. We had to tell people, we had to promote the center. We were doing crazy promotion. That is no longer the case. We have hundreds of phone calls and WhatsApp messages a day. So at this point in Honduras, we probably have too many patients. Empezamos en Honduras en la radio, promocionando, o sea, aquí viene una brigada, que vengan. Ahora no, ahora recibimos como más que ciento no sé cuántas llamadas por día. So in the Dominican, it's a little different because we're in the communities. So we are meeting the community leaders. We're actually out and seeing who needs surgery and doing that needs assessment. So we're like picking the patients in advance. So it's going to be a little different, but my guess is the word will get out. As they say, if you build it, they will come. Patients that just don't have access. Entonces en Dominicana empezamos en las comunidades, podemos ver los pacientes que necesitan ayuda y facilito, vamos a ir captando pacientes y ya después van a llegar. Yeah, good question, Dan.
I would just
Thank you.
I would just quickly add to that we are selecting our patients based on the urgency medically and also based on their need with the social work. So we try to meet the most urgent with the most need. But then we're also trying to be friends and have a good relationship with the medical community in Honduras. And so now at this point, we have doctors that will refer patients to us from the city. Because they know that we do certain specific procedures that they don't do or that is so expensive, then they refer them to us. And they know that we're not doing any business. We're giving surgeries for free.
Okay, other ideas or questions? We want to learn too. So we're hoping for some good ideas.
Ruben has a question or an idea.
First of all, just a thank you. We see each other, we get to know about each other a little bit of meetings, and we have the opportunity to see a face and a smile, and all of a sudden we learn about the work, which is monumental. And so not only technical, what you've offered to us, but also the passion and the genuine human kindness that's embedded in what you're doing is remarkable. And I'm also very taken by seeing so many of our colleagues from other organizations who are here to learn and to work with you. And I'd love to see some of those interactions continue so that we can learn from each other. So there's a lot that I could ask on human resourcing, to financing, to logistical supply chains, because to go from some projects initially to the operation that you have and growth takes all of that. But I will focus, the one question that I have will be just based on the fact that in Operation Smile, we're constantly, depending on where we are, making decisions on whether we'll have a standalone center, a surgical center, a non-surgical center, a mixed facility with someone with an institution of the Ministry of Health. The debate, we go back and forth. We need to engage with the health system, or maybe the environment is not ripe, so we need to have our own facility to manage patients. So it goes back and forth. So I guess my question to you would be how, it looks like you have a standalone facility and that's how you have managed and grown it. What processes did you take to actually make those decisions versus engaging directly with the health system, working directly with a national Ministry of Health type hospital, and engaging there versus having your own facility. So maybe the process or the pros and cons that you saw along the way.
Yeah, Ruben, with a minute left, one of the most difficult questions that I think everybody in the G4 and beyond is asking. For us, it was about really being able to have control over the facility and the care that's provided. It wasn't that we needed US control because we have a local team, right? So we wanted our Honduran team to be empowered to control the facility and really make sure that we could get the attention for our patients. I'll give, honestly, it happened organically, I would say. I don't think that when we first started, there was a deliberate question around it. Now, going to the Dominican, we did take a moment and pause and think about it, but I truly believe that the model has been successful because we have that local team and the local leadership like Dr. Marilyn, who has full control over those patients. I worked for an organization in Honduras. We signed a contract with the government. We went bankrupt, right? So the level of corruption that was at the healthcare system I was at bankrupt my nonprofit. So that was a problem. And then I'll give another example with our fellowship program. We didn't want to start a fellowship. We actually wanted to do the 4th year rotation of the residency. That's what we wanted to. But the coordination, we weren't able to really get those results that we needed and make sure that the program was running smoothly. This doesn't mean that we don't coordinate with the Ministry of Health. Dr. Marilyn is talking with his contacts as often as possible to get those referrals, to refer patients back. If we have a problem, we refer back. We're working side by side in the Dominican. We do all the permitting. We do everything that's required. We're in collaboration with them, but we just needed autonomy. So that's how we decided. But the con to it is we're not built into this larger system. We haven't quite gotten to the point where we're changing healthcare system in Honduras. We're providing a need. We really think the education program is the way to go beyond our 4 walls. That's how we're approaching it, as opposed to trying to build out the public system that we don't feel like is our role. So that's my short answer. Y lo dije en inglés. But Doc, what would you add or subtract to that?
Well, I would say that you need to have control if you want to have like quality and make a difference and get things going. A lot of the times in the national hospitals, like we have missions that come and they leave equipment, and then next time they come, there's nothing there. Or, like there's no one there to take care of that. So that's a big disadvantage, especially when you're working with them. Then they're overloaded with all these emergency cases that if you want to do something, it's more urgent to do this or that. And so all the elective part becomes so, like they just say, you need to go to the waiting list again, because we have urgent cases. So these people are being waiting there for so long. And so if you control the place, if you have when you start, you don't need to be waiting for the union to tell you when to start. You can, change the mentality. For me, one thing that was really frustrating when I was in training in medical school or residency for orthopedics, is just the fact that every time you try to change something, they say, well, we've done it like that for 30 years and it worked. It's just like you're stuck. And if you really want to make a big difference, you can still do it that way. But I think that is more successful depending on what your focus is, like, especially if you're trying to give a bigger answer to multiple specialties.
Yeah. And so I think we should all ask ourselves that question, and maybe One World Surgery does not do 3. Maybe our 3rd is a different model that, I'd love to help local healthcare systems do ambulatory surgery, because that's the thing I think that's missing in a lot of, low middle income countries. Ambulatory surgery is affordable, more affordable, right? And it works. So I'd love to help people set up their own centers. That would be great next step for us. But vamos a ver, we'll see. Yeah, and thank you everyone for the messages. I can just put and everyone's kind of signing off, I'll put my email here. Okay, ahí está.
Okay, thank you so much.
Yeah, thank you, Viviana, for having us. Muchas gracias, Vivi.
No, thank you so much for accepting the invitation. Gracias por aceptar nuestra invitación. Wonderful. Dan.
Bibi, again, thank you to Kate and Dr. Marilyn for such a wonderful presentation. Bibi, I had one other topic I wanted to toss out to members of the working group that are here. You know, I think we've talked about this, and an idea was put forward that maybe we could provide a platform for the candidates for the Director Generalship of PAHO, the Pan American Health Organization. And maybe this working group might be interested in helping to introduce global surgery to these candidates for the Director Generalship of PAHO, and to give them a platform, a forum to speak to the countries of the Pan American Health Organization region, the Americas. So if anyone's interested in that, maybe reach out to Bibi and me and Natalie. We're just trying to figure out what we might be able to do. The current Director General of PAHO, her second term will end late September, and there are 6 candidates that have been put forth by the various member states. And it might be nice to reach out to them and ask them about what they know about surgical, obstetric, trauma, and anesthesia care in the Pan America region, and what their views are, and what they think that they would do in this area if they become the Director General, and what we can do to help them, what support they would like from groups like the G4 Alliance and all of our member organizations. So if anybody's interested in that, maybe reach out to Bibi or me or Natalie, and we're going to try to figure out what we can do. Does that make sense?
Totally, yes. Yes, Dan, thank you for mentioning this. Yeah, for mentioning it. Thank you.
All right. Well, thanks everyone. Happy Tuesday. Suerte con lo que hace falta la semana. Gracias.
Muchas gracias.
Semana.
Gracias.
Happy week.
Thank you so much.
Thank you, everyone.
See you soon.
Muchas gracias.
Gracias.